Hello there. The British supply crisis is coming to a head, and now the corona fall is coming. The head of the National Health Service, NHS, is calling for people to be vaccinated again, but that doesn't solve the core problem. There is a risk that the labour market will be overloaded. 7 million people in the UK were waiting for hospital treatment at the end of August. That's a new record. In the previous month, it had been 6.8 million. This includes 2.75 million waiting longer than 18 weeks and 387,000 more than a year. The number of those waiting over a year and a half has declined significantly, but is still more than 50,000. The significant problems faced by the country's government health service, which is directly funded by taxes, are not limited to treatments that do not involve serious or life-threatening situations. In the emergency departments of the hospitals, only 57% of the patients were presented to a doctor within 4 hours. After a cancer diagnosis, less than 3/4 of those affected were able to start treatment within 2 months. For years, the National Health Service NHS has been in distress. During the strict austerity policy as a result of the financial crisis, not enough funds flowed into this, and many positions are vacant, partly because of a cap on the number of medical students. Around 7,500 places are available in England each year. Year after year, doctors and health economists warn of a winter of crises in hospitals. The NHS is preparing for a difficult winter ahead again this year, said Professor Stephen Powers, Medical Director of NHS England. He urged the population to get vaccinated against COVID and flu as soon as possible in order to keep additional patient inflow into the hospitals at bay. Additional burdens from COVID in the winter months are already becoming apparent. There are currently 10,500 patients being treated in hospitals because of the virus, more than twice as many as in mid-September. The precarious situation of the NHS not only has an impact on public health. The consequences are increasingly evident on the labour market. The number of economically inactive in the 16 to 64 age group increased by a fifth between June and August, according to data from the Office for National Statistics, the ONS. More than 375,000 people have retired from the labour force and given up looking for work since the pandemic began because of long-term health problems. With this development, Great Britain is the outlier among the Western industrial nations. From Australia to Germany to the United States, all states saw a significant increase in the employable population who were not employed or looking for work in the spring of 2020. But everywhere else, their share is back to pre-pandemic levels, and in many cases even lower. Since then, the proportion has been steadily increasing on the island. Britain continues to suffer from high rates of economic inactivity driven by rapidly rising long-term illnesses, said David Pye of in-work benefits consultancy Broadstone. He pointed to a significant backlog of necessary treatments that has accumulated during the pandemic and warned that the problems for the NHS are likely to worsen. We are entering a winter where the trajectory of COVID is unclear and soaring energy costs are likely to trigger further health concerns and increase waiting lists, he says. Extensive data on the health situation show that it is not primarily patients with long COVID that are causing the increase in those who are retiring from work for health reasons. The numbers of patients with chronic pain, heart and blood pressure problems, and psychological problems such as depression or anxiety have increased much more significantly. And there is no sign of the situation in the hospitals easing. The nursing staff is currently voting on possible strikes in the coming weeks in order to achieve better pay. Real wages for medical nurses have fallen by 6% over the past decade, according to data from the Royal College of Nursing. 47,000 positions are currently vacant. So far, however, the government has not made any concessions to the demands of nurses. If they get better conditions and pay elsewhere, they could leave, said Health Minister Therese Coffey. Well, they already managed that from the outside not many are coming in as before because of Brexit. And now saying this to nurses, that's appalling. And I'll see you in my next video. I'll be back.